Now, Dr. Dave Montgomery, a generalist and board-certified cardiologist in Atlanta who hosts the web series The Good Doctor TV. Good morning to you, doctor. Based on the data you're seeing now, do you think Boston Public Schools should reinstate a mask mandate?
Yeah, good morning to you, Adrienne. I think what the fear is, quite frankly, is that we would have a repeat of next year. Remember around this time last year, the Omicron variant came in and it ushered in the numbers that we hadn't seen in the entire pandemic. Unprecedented hospitalizations and cases. And although we called it less deadly, it really, frankly, had more deaths compared to other variants. And to me, I think it's a really good thing when officials are sitting around thinking, how can we prevent that from happening? I think what the big issue is that we are putting this in the sort of the category of liberties, like somebody's taking a liberty away, as opposed to charities. I'm doing something for somebody else. I'm going to help somebody prevent having COVID-19 or doing poorly from it.
I think that's a very compassionate way to look at it, for sure. And there was a study that was just released earlier this year in the New England Journal of Medicine that found that lifting mask mandates did lead to thousands of new COVID cases in schools across Massachusetts, compared to schools that retained their mandate. But where are we in this pandemic? Because, we can fear that we're going to repeat history, but as we've seen, the pandemic has changed, the strains have changed, and children have had fewer cases than grown-ups. So where are we in terms of cases?
Yeah, I think one of the wild cards here is how the COVID-19 virus, in a sort of uncanny way, can spread without any symptoms whatsoever, first of all. If you look at Massachusetts alone, they had to deal with last week about 11,000 hospitalizations, 11,000 cases, 1,000 hospitalizations, and 100 deaths. They're thinking, hey, this may be a bellwether. We should be getting in front of this. I know the kids do better with COVID-19, but the teachers may not, right? Because you have older teachers. You've got people who have family members. And what the problem is here is the drain on the hospitals and the hospital system, the drain on the economy when you have people that miss work and have to take care of kids at home and miss work. I think there's a lot here. What I think we should be, sort of thinking about this is not an indictment about, how healthy you are or how well you take care of yourself. This is more of a testament of how uncanny this virus is. And for 2 weeks, let's just put on a mask. I'm asking you to put on a mask and let's see if we can prevent this from happening again like it did last year.
What would be the significance of 2 weeks? Is 2 weeks enough?
Yeah, so great question. And I think we learned at the early part of the pandemic from scientists that the duration of infectivity, my ability to pass the virus along and transmit it, is about 10 to 14 days. And so if you think about it, really just be, 2 weeks, which 10 days of school, can actually, whatever virus is out there, would decrease the amount of transmission and stop this sort of spiral that we could get ourselves in around the holidays.
But I have to ask you, because I think there are a lot of parents who believe that this is a freedom of choice issue. If masks are so effective, then why not let parents decide if they want to put masks on their kids? Then those who are masked and choose to do so, those teachers who choose to do so, would be protected if masks are so effective. And those who aren't masked can be free to not have one on.
Yeah. So, if I take off my doctor hat, I would agree with you. Let's let people decide. But what I think we could do in the medical community, if I put that hat back on, is to make sure that all the information is out there, that people have accurate information about the virus. This virus, you may feel like you're fine, but remember there's a such thing as pre-symptomatic, the 2 or 3 days before you become infectious at all, and you can pass it along. If we get the information out and then we allow people to choose and say, hey, masks really help us and our families, I think you'll get more buy-in than we're seeing right now.
Dr. Dave Montgomery, thank you for your time.
Great to be with you.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.